So this is John Miner from Spark going over a lumbar spine exam. This exam will be comprehensive over lumbar spine pathology as well as some sacrum or SI joint pathology as well. As we begin inspection, palpation, range of motion, and various special tests, I like to inspect my patient in a standing neutral position, looking for shoulder symmetry. We can also palpate for pelvic symmetry, for iliac crest height, which we have here looks very symmetric. I also like to test for scoliosis right off the bat as well, particularly when we have a lot of young pediatric patients. So go ahead and extend your arms out, lean forward like you're touching your toes, and we're looking for symmetry over the thoracic and lumbar spine, and she looks great there. I will let you extend and stand back up big and tall. As part of our exam, we also do a flexion test, so we can also ask our patient if that was at all painful on the back as she flexed forward. We typically think of disc pathology as something that would cause pain with forward flexion. Next, I like to move into palpation, so I will have you face away from me, and we will palpate a couple of different areas. I like to anywhere through the lumbar spine, but if you can first identify iliac crest so you know about where your spinous process for L4 is going to be in the midline, and then you can either start top to bottom. But the first thing I like to really palpate and test for is pain if you palpate through the spinous process. This, if painful, many times is an indicator for a spondylolysis or spondylolisthesis. So starting at L4 and then also palpating slightly lower. She's got a belt on. Normally I would have her take that off, but we would palpate through L5 and even down into the sacrum. And don't forget to move upward, even though the rate and incidence of either of those spondy conditions are much less common as we move up the spine, but you can palpate into each of those bony processes. You can palpate in the setting of muscle spasm, muscle strain. She may have some paraspinous muscular pain, so palpating through those muscle bodies, seeing if that elicits any pain. And then you can also identify much deeper and slightly laterally the quadratus lumborum, which in some athletes will go into a spasm or strain, and so you can palpate that much more laterally, and it's a big bulky muscle that can elicit pain. Other places I like to palpate right along the iliac crest, so as you find that iliac crest, just palpating where the abdominal muscles will attach, as well as paraspinal muscles. Moving into the SI joint, once you identify the posterior superior iliac spine, which in this case is right about there, and then moving slightly medially, you'll feel the little depression for where the SI joint is, and then palpating through the SI joint on each side as well. While I have her in this position, I'll start one of my special sacroiliac tests that's very specific for it if used in conjunction with a number of other tests. But you can perform a sacral compression test where you'll press several times right into the body of the sacrum and see if that seems to elicit any low back pain. Now, with my patient standing, we will move on to other special tests. So we have already done forward flexion test eliciting more disc pathology. The next test we will do is a lumbar extension test. So just have your patient extend backwards. Many times they'll stop early if it's incredibly painful. And we're just asking if that's painful at all. Anything from facet pathology, sacroiliitis, spondy injuries will oftentimes elicit pain with extension. Then we can perform a stork test. So I have my patients give themselves a hug, stand on one leg, and then extend backwards. And we'll perform this on each leg, seeing if we can elicit any pain here. Again, these are all of our extension tests, eliciting pain with facet, SI joints, or spondy. Then you can perform a Kemp test, which is going to be a rotation, and then tilting backwards, leaning backwards towards the back shoulder, and then rotating around the opposite direction, eliciting for any pain there. So those are our standing special tests. The last test, I will have you lay flat on your back here. As far as disc pathology, we like to perform a straight leg raise test. So make sure your patient is nice and relaxed. They don't need to be helping you out, otherwise it alters the results of this test. So have them just relax, and as you raise their foot up, you're asking if they're having any back pain, shooting pains down the leg. Anything, typically we can get our patients up to 30, 45, sometimes 60 degrees without eliciting any pain at all. And then you can always compare to the opposite side as well, seeing if they seem to have more problems on one side or the other, which could give you an indication of which side the disc pathology is coming from. So we've tested for discs in this case. Now we'll move on to some of my special sacroiliac tests. This one is called anterior pelvic distraction test, where you'll identify the anterior superior iliac spines and just give anterior pressure through and see if that elicits back pain at all. You can press on one side at a time. This next test is called axial loaded thigh thrust, so flex the hip to 90 degrees, slightly adduct the body, and then press through the knee. We're going to load the SI joint there, seeing if that elicits any pain. Opposite side here, also testing there for any low back pain. Usually it's going to be isolated to one side or the other. Then I'll have my patient lay on their side. Go ahead and roll onto your right side, and we will perform what's called SI torque test. So I'm going to palpate and identify the anterior superior iliac spine, wrap my fingers around it, and then on the back of the hip I'm going to compress into the posterior iliac bone, compressing, kind of torquing that iliac bone and compressing the SI joint to see if that elicits pain. And then one final test, we would of course test that on the opposite side. You can do a lateral compression test of the pelvis, which can be done either lying down or standing. But in this case, we're going to squeeze the spine, squeeze the pelvis, and see if that either causes pain, a sensation of stability. I've had patients tell me they have kind of a numb, tingly sensation, and occasionally there's no difference, which would be a negative result there. And then finally, while we're talking about back, go ahead and sit up and actually stand up for me. It's important to also test strengthening and some reflexes. So big muscles, nerves that we want to test are going to be getting up on tiptoes, walking in place, making sure that she's got adequate control of the calf, and then switching, so being on your heels, walking in place, and then testing for a couple of reflexes. I'll have you have a seat one more time. You don't need a reflex hammer. I like to just use a gentle knuckle, and making sure that we've got symmetric reflexes on each side as well. And finally, just sensation, making sure that the sensation feels normal and the same on both sides. And that will do it for a relatively comprehensive back exam.